Welcome to your Aged Care Compass podcast. Join us to find out how to support your older loved ones at home. We're going to help you make sense of Australia's aged care system. We talk about legal and financial considerations for ageing and how chronic health conditions impact your older loved ones' wellbeing. And we share real-life stories of where it went wrong for people and how we got them back on track.
Welcome to episode 6 of your Aged Care Compass podcast. I'm Michelle and I'm your host today. What I'd like to talk about today is the Transition Care Program. If you remember my chat with Janine last week, she mentioned that the Aged Care Assessment Team, or ACAT assessors, can approve for the flexible care programs. These include short-term restorative care and transition care. I'll be focusing on the Transition Care Program, or TCP, today. The Transition Care Program, or TCP, provides short-term support to assist an older person to get back on their feet after a hospital admission. So the orientation with TCP is having a team of clinicians to support a person who is in hospital to transition home safely and regain their strength and wellbeing at home. The big difference between TCP and STRC, which is the short-term restorative care program, is that for someone to be eligible for transition care program, they must be in hospital. There must have been a hospital admission. That's the really big thing to remember here. So how does the assessment work for TCP? Well, the person must have been reasonably independent and managing well before coming into hospital. But the illness or the injury has caused some functional decline or limitations in the person's ability to manage as well as they did before they were admitted to hospital. A person must be in hospital when the referral for TCP occurs. So if someone presented at an emergency department or they had a brief admission into hospital, they're not grounds for a referral to TCP. And part of the reason for that also is because the process of assessing someone and getting them onto the program takes some time. It's important to remember that people can't go home and then be referred for TCP. So that TCP referral, the TCP team must have received that referral while the older person was still in hospital. They need to be assessed while they are in hospital and then accept them onto the program and then facilitate their discharge home from hospital to begin the TCP. Any clinician on the person's hospital treating team can make a referral to TCP. Often it would be the physiotherapist or the OT, the occupational therapist, as these are two of the main clinicians who work in the TCP team. How it would work would be the hospital physio would speak with the TCP physio, the hospital OT would speak with the TCP OT, and between the hospital treating team and the TCP team, they'll determine if a person can be accepted onto the program at discharge. So because TCP is a clinician-led program, the referrals between the hospital and the TCP team generally occur from one clinician to the other. But it may also be a junior doctor referring to the TCP admin person or the ward social worker referring to TCP admin. It actually doesn't matter who makes that referral as long as it's done in plenty of time so that the TCP team can review it and see if they have capacity to accept a person onto the program without delay. A referral to the TCP team should not occur when someone is just about to be discharged from hospital. A week before would be the bare minimum. Any less than 1 week, and it doesn't give the TCP team time to act on the referral. The treating medical team would already be planning for the older person's discharge. And, with hospital beds always full and management expecting the medical team to have people discharged as quickly as possible to free up beds for people coming in by the emergency department, the treating team will aim to discharge the person on the proposed date. They won't want to wait for another week until the TCP team has processed the referral and comes to the hospital to complete their assessment. So we suggest to people to begin asking about or suggesting TCP to your older loved one's treating team as soon as possible after admission to hospital. Transition care is a program that's in high demand and there's always a wait list. When people are assessed in hospital to be discharged home on TCP, they must stay in hospital until a place on TCP becomes available. This is another reason why a referral to TCP needs to occur as soon as possible. And sadly, there's so much pressure on medical teams to discharge people and free up beds that this will unfortunately prevent some people from getting access to these excellent programs. You know, we've had experience where clients were actually quite eligible and quite suited to going home on TCP, but the treating medical team refused to allow the referral because it would delay the discharge. The other important thing to know is that it doesn't matter if the older person is in either a public hospital or a private hospital. Both are eligible to be considered for transition care. Being a private patient in a private hospital does not exclude the older person from being considered for transition care program. So how does TCP work? Well, the duration of TCP is up to 12 weeks. So some older people need the entire 12 weeks to regain their optimal functioning, and some people don't. They need less time. The amount of time a TCP episode runs for will be determined by the TCP clinicians in consultation with yourself and your older loved one. And it's actually possible to get an extension to the TCP episode of up to 42 days. This extension is determined by your older loved one's treating TCP team during the time that they're receiving the program.
FlexiCare is a not-for-profit organisation which supports older people living in Brisbane's southern suburbs to live their best lives in their own homes and communities. FlexiCare don't have grand plans to be the biggest aged care provider. They want to be known for treating each one of their participants as an individual who they get to know well. They answer their phone calls personally when clients ring them. They give their clients easy access to a home care partner who can work with them to deliver the best mix of support possible. If you're in Brisbane South and want to know more, give their friendly team a call on 07 3422 8400 or check out their website flexi.org.au.
Now, TCP can actually be delivered in a variety of settings with the aim to have your older loved one complete their program at home. So an older person might be discharged and go and stay with their son or their daughter at their home for a short time and then move back to their own home, all the while being treated on TCP. It can also be delivered in a residential aged care setting too. That is, beds in an aged care facility are arranged as part of the program, and therapy can be delivered in this setting to start off with, aiming to support your older loved one to move back home while they're still receiving TCP. So because it might start in the aged care facility, it does not mean that the person is being admitted to the facility permanently. Because the whole idea of TCP is that it's aimed at preventing older people from having to move into an aged care facility prematurely. So if on discharge, the plan is to move your older loved one into an aged care facility, this would make them ineligible for transition care program. Because remembering, the goal of TCP is to get your older loved one back on their feet so they can remain at home. The other really good thing about TCP is that it can still be used even if someone already has a home care package. So they can still be eligible for it, regardless of whether they have the home care package or not. What would happen is if the person was to receive TCP, they would need to pause their home care package while they were receiving TCP. And then once that TCP is completed, they can revert back to receiving their home care package. So when the TCP team receive that referral from the hospital treating team, they'll liaise with the hospital team to determine how close the older person is to being discharged. They'll be watching how they progress in recovery from illness or injury. And when the hospital team decides the older person is almost ready to go home, the hospital team and the TCP team will decide upon a discharge date together. The TCP team will then begin planning for the older person's supported transition home. Specifically, the TCP physio will be talking with the hospital physio about continuity of a prescribed physio program. The occupational therapists from both the hospital and TCP will be discussing what equipment or modifications may be necessary to support functional optimisation at home. And the nurses may be discussing ongoing wound care. And then there are things like if the older person needs some assistance with showering, this can also be arranged, as can assistance with cleaning the house, shopping and meal preparation. So all these services can be arranged via the TCP team. In the first couple of weeks after being discharged from hospital, the older person will be visited at the location they are receiving TCP by all the clinicians involved in their care. As the program progresses and the older person improves, the clinicians will hand over to their allied health assistants. So the physio will prescribe an exercise program and an assistant may visit thereafter to supervise the progress. It will be expected that your older loved one or the older person will attend to their exercises each day so that they can show the therapist progress over time. The occupational therapist will have hired equipment such as shower chairs and mobility equipment and arrange to have grab rails or ramps installed as required. And nurses will continue to provide wound care or specialised clinical support if required. If the older person was receiving services from the Commonwealth Home Support Program or CHIS prior to the hospital admission, these services can continue as long as they aren't the same services that TCP is providing. So, for example, if the older person was receiving cleaning under CHIS funding prior to the hospital admission, TCP won't also provide cleaning. So, TCP is an excellent program to support a discharge home from hospital. It's designed to get your older loved one back on their feet, literally. So I guess the takeaway is don't delay in asking your older loved one's hospital treating team about transition care program if your loved one is admitted to hospital. The sooner you highlight this as an option, the better the chance of having the treating team support this plan for discharge. And just, I guess, as a real life case, this is exactly how we use transition care program for Dad. So in a nutshell, he had his home care package level 4. He had 4 strokes in the last year of his life, each time being admitted to hospital. So for 2 of those hospital admissions, including the last admission, we had Dad discharged home on TCP. Dad was not going to be admitted to an aged care facility. And the previous time he was discharged home from hospital on TCP, he did really well regaining his function. Dad's home care package funding had hit its limit, so there was no funding left to engage a physio or an OT at home. And saving up enough funding to have a physio or an OT come to Dad's home would have taken months. So getting Dad home and keeping him at home was only possible with TCP. Dad required 2 people to help him transfer when he first came home after that 4th stroke. He had some strength in his legs, but he couldn't get out of a chair or a bed by himself. And it was really heavy work in those first couple of weeks after the 4th stroke. But gradually he became stronger. He did the exercises with his carer every day. And by the end of the 12 weeks was getting out of a chair and out of bed by himself. And he was able to walk without a mobility aid. After the fourth stroke, Dad remained at home until January the following year, and that's when he passed away. But without TCP to support Dad to come home after that fourth stroke, I don't think we would have managed. So that's it for today's podcast. I hope you all join us next week, and we look forward to seeing you then.
Hey Care community, thanks for listening to this episode. So you never miss a show, make sure you subscribe to our podcast. If you'd like to know more about what we do, head to our website, cmeacn.com.au.